Hello everyone and welcome back to Medi Notes or Medicos. The topic that we're going to deal today is anaphylaxis from microbiology, immunology topic. The objectives we're going to deal today is the introduction, mechanism, the pharmacological indicators, signs and symptoms, the types and the treatment. So what is anaphylaxis? It is a classical immediate hypersensitivity reaction. It occurs within seconds of exposure to the antigen. It comes under type 1 hypersensitivity reaction. The mechanism is very simple. What happens is the antigen it composed to IgE bound to mast cells, basophils and possibly eosinophils. Now what happens is this mast cells it goes and binds with the IgA to the antigen and this releases the inflammatory molecules. Now once the inflammatory molecules is released, what happens is allergy symptoms results, and because of this, in subsequent effective phase, exposure to the same allergens would cause a cross-linking of the cell which is bound with the IgE antibodies. Now when this occurs, what happens is there's an increase in the permeability of the cells to the calcium ion and then degranulation occurs. Once the degranulation occurs, the biological active substances that contains in the granules is discharged out. Okay. So what is the pharmacological mediators? First is histamine. Histamine is the most important vasoactive amine in human anaphylaxis. How is it formed? It's formed by decarboxylation of histidine, which is found in the granules of mast cells, basophils and platelets. And the use of this is what does the histamine do is it induces the smooth muscle contraction. When we go to the next one, which is serotonin, it is derived by decarboxylation of tryptophan. Histamine was formed by decarboxylation of histidine. Serotonin is formed by the decarboxylation of tryptophan. Now this also causes smooth muscle contraction. Along with that, it causes an increased capillary permeability and vasoconstriction. The next one is the chemotactic factors. Okay. Now the chemotactic factors is also known as ECFA, that means eosinophilic chemotactic factors of anaphylaxis. This is released from mast cells granules, that is acidic peptides is released from the mast cell granules and contributes to the eosinophilia which is accompanying many hypersensitivity states. Next is the enzymatic mediators. This consists of the proteases and hydrolases. The next one after that comes the secondary mediators. This stimulation is done by the mast cells, basophils and other leukocytes. When we go to the prostaglandins and leukotrienes, they are derived from two types, that is arachidonic acid and by two different pathways. And this affects the secretion by mucous glands, platelets, adhesion, permeability and dilation of the capillaries and pain threshold. Next is the platelet activating factors. This is low molecular weight lipid. This is released from basophils. So what is the function of platelet activating factors is it causes the aggregations of the platelets. Next is other mediators. So what are the other mediators that comes under it? That is anaphylatoxins, which is released by the complement pathways, that is C3A, C5A activation. Then bradykinin, kinins formed by plasma kinogens. I'll be going to the signs and symptoms. So the first one is the anaphylactic shock. So how does the anaphylactic shock occurs? It begins with the itching of scalp and tongue. Then flushing of skin can be seen, difficulty in breathing, nausea, vomiting, abdominal pain, diarrhea. Other changes what we see is edema can be seen, decreased coagulability of blood is seen, decreased BP, decreased temperature, leukopenia, thrombocytopenia, acute hypotension, loss of consciousness. In severe cases, it can even lead to death. Now we'll be learning about the types of it. So it comes as cutaneous anaphylaxis, where a small shocking dose of an antigen is administered intradermally to a sensitized host, and what happens is a local wheal and flare formation occurs like given in this picture. Then we have the passive cutaneous anaphylaxis. Here this is extremely sensitive. It occurs in it has an in vivo method and it is done for the detection of antibodies that can passively lead to this. cutaneous anaphylaxis. Next is anaphylaxis in vitro. It is also known as Kuhl's tail phenomenon, and it is the tissues from the normal animals which can be passively synthesized by treatment with the serum from the sensitized animals. Next is, what is the treatment that we give? We prompt the treatment with adrenaline, that is 0.5 ml of a 1 in 1000 dose intramuscular or by subcutaneous scratching. So that was the video for today. I hope you like this video. If you like this video, don't forget to like, share and subscribe to the channel. We'll be coming with more videos. Still then, stay tuned and happy learning. This is Ashna Viraju signing off for today. Bye.